E sim, deixa eu apresentar Friedberg. Ninguém mais, ninguém menos do que Robert Friedberg é o nosso convidado do Meu Sofá, que vai entrar agora aqui no nosso programa, certo? O Robert Friedberg é autor de 11 livros e supervisor titular do Beck Institute. Ele também é psicólogo, né, na Universidade de Palo Alto. Ele é professor e diretor lá também do Centro de Estudos de Ansiedade para os Adolescentes. Ele é PhD em Psicologia Clínica pela California School de Psicologia. Ele é chefe também do Pediatric Behavioral Healthcare Emphasis na Califórnia, e ele é simplesmente uma das pessoas que criaram a TCC Infanto-Juvenil. Ele foi pupilo do Beck e falou: por que não, Aaron Beck, a gente trazer a TCC para trabalhar com o público infanto-juvenil? E daí ele começou seus trabalhos maravilhosos, começou a adaptar para esse público, e ele é um ícone, ele é simplesmente um dos grandes nomes da TCC mundial, e ele está aqui hoje para você do Psicologia em Destaque. Então, fiquem com ele, aproveitem o conteúdo, já eu volto. How are you? I just put to record here. How are you?
I am fine. So nice to meet you.
So happy to have you here with me. I don't know if you can see here, I have 2 books written by you.
Oh, that is so flattering.
Yes, I have 2 here that I really love, and I always tell to my students to buy them because you are really an icon for us.
That is, again, the best I can say there is that it is just so flattering. Thank you.
Oh, thank you so much to accept my invitations to be here. And I'm sorry if sometimes my English is not perfect because, you know, in Brazil, we don't use English at all. Yes. So I will try my best, okay?
I'm sure you'll do fine, Anna.
Thank you so much. And as you said, I can call you Bob, and I also have a nickname that it's almost my name. Everybody here is called Cacao.
Okay.
So you can come this way if you think it's better for you.
Which would you prefer?
You can choose whatever you want.
Okay. All right. Let's stay with Anna.
Okay. Perfect. So I think talk with you here is a really privilege, and when they will hear you, will be very nice also for them.
I'm again happy to do this. This is so much fun for me.
Thank you so much. Robert, can I call you Bob? Yes?
Please
yes.
do.
So Bob, how you see psychology nowadays? Like, what's different when you graduated like some years ago?
Well, when I graduated, that was I got my PhD in 1987. Mm-hmm. So that's more than a lifetime from probably many of the people who are listening or watching. Mm-hmm. So again, one of the biggest things is that cognitive therapy was in its infancy back then. Mm-hmm. That when I was in graduate school, that there was only really behavior therapy and psychodynamic, psychoanalytic therapy. Mm-hmm. Those were the 2 major players. Now, 30 plus years later, almost 40 years later, cognitive therapy is the gold standard.
Yes.
So that's probably the biggest thing. Mm-hmm. Additionally, that psychotherapy and cognitive therapy in particular is becoming much more diverse, and as much in terms of the populations, the settings, the applications of it, you know, that essentially with adults, mm-hmm. Cognitive therapy is now being successfully implemented with schizophrenic patients, mm-hmm. which back in the 80s, you would never have thought that. So, you know, it's radically different. Also, you know, in terms of the providers mm-hmm. cognitive therapy, that is, school counselors, nurses, teachers at some places. So all of those type of things have really changed.
And I think you are a main, how can I say, you are very important in this movement of CBT, especially with children and adolescents, because here everybody can see 2 books written by you that are very important here in Brazil. We study a lot using your books. So how do you feel to be like a main name of CBT in world?
That is, first of all, that's so nice of you to say. Second, it's very humbling. And it's also really kind of gratifying as well. So as a third thing, that essentially that I have really been extremely fortunate to have fantastic mentors from graduate school to internships to early career people. And one of the things that all those mentors had, in particular, Christine Podesky, Connie Dallenberg, Julian Meltzoff, Aaron Beck, all of those people really fostered my career. And one of the, again, another person that was just hugely instrumental was Ray Fidelio as well. And that the things that Fidelio and Beck and Podesky and the others had in common is that you pay it forward. Mm-hmm. So that for me, if I've inspired someone, if I've mentored someone, if I've helped someone take better care of children and adolescents, that sort of was my obligation in being so well trained by some of these giants in the field.
And now you are a giant in CBT,
Which again, and if you had asked me when I graduated, would anybody refer to me in that way, I'd be very surprised. So it's very humbling to hear that.
Yes, and you are really an icon. And for that reason, we are so happy to have you here in Psychology em Destaque, talking with our students, because I think when you talk about CBT with children and adolescents, your name is the first name that comes to our mind. So I think it's a really great opportunity to have you here and hear you. So I need to tell you 100 times, So thank you so
much. Again, so nice to hear that.
So what do you think is the main difference between CBT with this public and with adults? What do you think is the main difference?
Well, I think, one of the things, and again, this is something historically that may be interesting to people, is that when I was a postdoc way back in 1987, that I talked to Dr. Beck about applying the model to children. Mm-hmm. And what he thought the struggles were and those type of things. And he was so encouraging of my work at that point. Mm-hmm. And I think that enabled me to find my own voice in adapting it to young children. And that it really has to be a bit more playful, mm-hmm. and more engaging, perhaps, and even entertaining than you do with adults. And so, one of the things, again, that I took great inspiration from was certainly Dr. Beck's work and the work by Phil Kendall with mm-hmm. Coping Cat. Mm-hmm. And that really inspired me in my formative years to think out of the box and do more playful things with kids than you would do with adults.
Yes. So, sometimes most of the concepts that you bring in your books, we can also use with adults. So sometimes it's easier for them to understand the way that you said. So what do you think about it? And do you work with adults also or no?
I used to, earlier in my career, but I've, over time really narrowed into specializing with kids and adolescents, children and adolescents. But particularly when I used to work in an inpatient setting, that the more simply and accessibly you can deliver the CBT to people, that they acquire it and apply it better.
Mm-hmm.
So yeah, I agree. I agree.
Yes. Sometimes they think it's funny, so it's easier to learn the concept. So I really like, I also work with young adults, and I think they really like when we talk in an easier way,
Yeah, absolutely. Adding fun to therapy is a really important thing,
Mm-hmm.
because again, we do serious work,
Mm-hmm.
but we don't have to do it in a heavy-handed manner.
Mm-hmm. So how about the parents? What's the main difficulty that you see in work with the parents? And because when we work with children and adolescents, sometimes we have to talk with the parents. We have to involve them. So can you talk a little bit about it?
I think the more, and again, both in clinical practice, both in my experience, and the research seems to support this, is that if you collaborate and engage with the parents, you have a much greater likelihood of success. So one of the things that I try to do very early, unless it's, contraindicated and is that the parents are hugely problematic, is I almost always have the parents in session with the kids and adolescents, unless the teen or child.
You mean the same
says no.
session or not?
In the same session.
Okay.
Because I only have, usually 50 minutes or 30 minutes per week with the young person, and they're with their parents the rest of the time, essentially. So I use them so that they know what I'm doing, that they can extend and generalize what I'm doing with the youth. Oftentimes it's revealing to both of them. So oftentimes if the child says something, I'll look to the parent and I'll say, what's that like to hear your son or daughter say that? How does that change how you see them or see their problem? Again, this gets also to another layer of the question that you asked, which is when you're working with parents, you really have to get what their perspective is. And sometimes they may come in with a different view of the child's problem than you do. And if those two things kind of come up against each other, then the parents are going to get dissatisfied and they may pull their child out. So that what I try to do is help. That's a one way to help them be on the same page as myself and the child that I'm working with, so they see what they're doing. Let me tell you, if I can, I'll tell you a story about that.
Yes,
this is a tricky, right? A tricky one, which is I had a boy who came in and he had OCD, and he had very significant contamination fears, and he feared that he would, unless he washed and cleansed himself repeatedly. He was taking hours of showers a day and washing his clothes and bed linens.
How old was he?
He was a teenager.
Oh, okay.
He's a teenager. Bed linens, repeatedly. And he was afraid that he would give his family AIDS. Now, the boy had never had a blood transfusion or had never had sex with anyone. So naturally, he did not have AIDS. That after we did some psychoeducation as to how AIDS was transmitted, it turned out that he was masturbating in his room. And then, of course, he would ejaculate, and he would fear that the sperm would contain AIDS and then contaminate anything he came in contact with. So he did all this washing and cleansing and etc. We did some psychoeducation, did some simple sort of prep work with some cognitive restructuring in session 2 and 3. They come back session 4. I see them in my waiting room, and they are just ecstatic. They are like thrilled, and they came back and they said, "Dr. Bob, you're a miracle worker." Right? They said the showers are done. He's not washing. Everything's back to normal. When do we stop therapy?
Only 4 sessions. Yes. Only
4 sessions. Well, wait. Here comes the cliffhanger of the story. So they're all excited, and I said, "Well, let me just speak with the kid again alone." Right, and the parents go out of the room, and I said, "How much are you washing? Normal times, blah 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 blah. How much you doing your laundry, blah blah blah. Normal times." I said, "Well, how much are you masturbating?" And he goes, 0. So that's why the symptoms were gone. So naturally, right, the treatment had to be that he had to wash normally and still masturbate. Right?
Yes.
So, but when we looked at the treatment plan, if the parents, and then we naturally included the parents after we had that talk, that if they didn't know what was going on, they would think that was kind of a crazy approach to treatment. Right? So that's where the parents really have to be on the same page. So otherwise they may think, what in the world is my child doing with this individual in treatment?
Especially in a theme like this, like when you talk about something related to sex. Yes.
Right. Exactly.
Yes. So this is a perfect example, to talk about.
With the parents.
Yes. So we need to bring the parents to therapy. Yes. I think sometimes some therapists, they have some difficulties to talk with parents. I can see that sometimes they feel like afraid or ashamed. So can you give some tips to work with parents as a team?
Well, I think, that again, in doing a lot of supervision with therapists who have that, again, not surprisingly, it comes to their beliefs about the parents and themselves as therapists. So often, particularly with younger clinicians, less experienced clinicians, that they may feel uncomfortable for a variety of reasons working with the parents, because let's say they don't want to undermine the parents' authority, or they may see themselves as subordinate to the parent, or not qualified to give any sort of parental direction, or all of those type of things.
Yes.
and again, a quick story. That I was working with a supervisee. She was she was 22 years old, unmarried, and did not have children, just entering the field. Was doing some parent training, or needed to do some parent training with the family. And she said, how can I do this? I don't have children of my own. I'm not a parent, all those type of things. So we did some Socratic questioning, which is, are the only people that can help parents therapists who have children, right? And kind of talked about those type of things. If that's the case, right, you're cutting out a whole amount of providers,
Yes.
Who are working with them. So I think the biggest thing is to do your own self-talk if you're uncomfortable with working with parents, so that you get more comfortable with that.
Yes, it's really nice when you talk about this, because we have a lot of students here, like they are still student CBT. So I think sometimes they have trouble in call the parents and involve the family. So it's really important to get this on mind. Like, I have to do my supervision. Like this is really important to improving the career. So what do you think is the most important item when you work with CBT with the families?
And again, that's really, and another great question. CBT gets back to the first question, which is the extensions of CBT, right? So CBT family therapy is something that came probably 20 years ago, but wasn't around when I was in school. That you have to see the family unit kind of made up of how many members are in it. The parents have their schemas based upon their backgrounds and childhoods, that each of the family members are going to have different beliefs about what makes a good family, what makes a good brother, sister, mother, father. So you have to work with all of that. For me, I like that because it's very exciting, because you've got four people, or 4 people or more or so often in a family session, and their beliefs and assumptions bounce off against each other. Again, quick story. So I
love your stories. So keep going.
All right, good. That's fortunate. That the father had the belief that children should be essentially seen and not heard. The mother had a belief that children should have more freedom and be sort of contributing, more of a collaborative parenting type of thing. So naturally, they were in conflict, and were giving different messages to the children, and they were angry with each other. And when we identified these beliefs that the parents had in session, and what was helpful for them was that the father was acting that way according to that belief because he believed that made him a good father. The mother was acting in that way with that belief because she believed she was being a good mother. They're both accurate, right? So that their intentions are perfect, right? Everybody wants to be a good parent.
You're trying their best, yes?
Yeah, it was based upon how they were brought up and how they came to define what a good mother or father was, or what an obedient child was, and they just needed to understand that and negotiate some sort of middle ground between those two.
Yeah, so it's important to find like this point between them, and to help them to talk about and to find a way, a really good way. So I would ask you, I think my next question, it's kind of similar. So how about the case conceptualization? Do you think it's really different to do with a case with kids and adults? Do you think it's different? Because most of the time when we are working with these younger kids, we need to put the parents in the process. So I want you to talk a little bit about it. Can you talk?
Again, boy, Anna, you ask such good questions.
They are very similar, you know.
That for me, I think, and again, I mainly, in the last 20, 25 years, I've mainly only focused on children and adolescents. But if I were to compare case conceptualization with adults and children, I think one of the big differences is that the context is so important for children, because often in certainly in my past work with adults, that you're working with sort of an individual adult who may or may not be in a relationship. That varies. Kids are always in a relationship with someone.
Yes.
Right. And they're also in a different context. They have to go to school. Right. So that, there are certain demands that are placed upon them that may or may not be placed upon an adult. So the context, and then there's a development 7 are different than at 11, at 15, at 18, etc. All of those type of things. So that you have to consider all those variables, which are, for me, more complex than when I was working with adults.
Yes, we have to adapt our voice, our way to talk, to adapt everything. Because when we are seeing children with like 5 years old, it's completely different from a teenager. It's completely different. Yes. Yes. Yes.
And again, that you can't use big words. I try, even with parents, I try not to use big words. But yeah, you have to adjust.
You have to do it with children like me talking in English, like small words, small.
Yeah. Translation, right?
Yeah.
That you have to translate for whatever age group.
Because sometimes it's hard to think about a really big sentence in English. So I think it's the same thing when we are working with the youngers,
And Anna, by the way, your English is perfect.
It's fine. Thank you so much. Sometimes it's hard because here in Brazil, I don't talk English, never. Just when I'm traveling or studying something, or when I'm go to lecture, something like this, or when I'm talk with some great teachers like you.
Well, your English is.
I used to live in Philadelphia because I attend 2 classes at Beck Institute, like some years ago, like 10 years ago. So I had my I forgot the word, my training there. Yes, 10 years ago.
How did you like Philadelphia?
Oh, it was amazing. I had a lot of friends there, and it was a really great opportunity to have classes with Aaron Beck. He was an icon. So I had some opportunities to talk with him and to listen to him. So it was really great time in my life. I think everything changed my career, like this time there.
Well, that I'm going to ask you this and then finish it. I've come up with another story. But so when you think about being with Dr. Beck and the other folks at the center, at the Beck Center, what was the best part?
I think actually I was really young, so I think the whole experience changed my life, because I was like 22 years old, I think 21. Now I'm 33, so there's more than 10 years. And this is the main point, like the whole experience, to spend like a year there, and then to have classes with the biggest names in CBT, and to have the experience. The experience there was really different from Brazil. Here we don't have practice. We have, at that time, we had a very small books in CBT. So that experience really changed my life as a psychologist and as a person at all. Like, was really amazing. I have no words to define, actually.
I think, again, that's such a common experience to for people who go to the Beck.
Yes.
And who have met Dr. Beck.
Yes.
And the colleagues at the center, that again gets back to one of the earlier questions you asked me, that Dr. Beck is one of the most generous people with his ideas and his time.
Yes.
That one of the things that, again, I met him at my postdoc at 87. And one of the things over time that he always was interested in, and he always began with, what are you doing? How are you applying cognitive therapy? Mm-hmm. And then he would talk about what he did, that he was always interested in sort of learning what you were doing. So that was, again, something that is, also totally consistent with the model.
Mm-hmm. Yes, and he is like a great master, and also very humble. And I think all the greatest therapists that I had the opportunity to talk, like Hugh, like him, like also Christoph Lutz, he is my supervisor nowadays in chemotherapy. And I think all of you, that you have like a similar way to talk, to be open. I think this is really a common thing between you great minds in psychology world, So I think you all are amazing, like really icons. You are very open to talk with us, So thank you for that.
And I think that's part of the model, right?
Yes.
Yes. So yeah.
I think therapists that doesn't, maybe they didn't understand the really thing about CBT, Yes.
Yeah, and that, again, another great point is that really, as you progress, as you get it, this is really mainly to your students, that you live the model. That again, I don't know if you've heard this story about Dr. Beck, that he just died, right?
Yes, I think
in November.
Yes,
and one of the interesting things that Judy shared about his later years, when he lost his eyesight, he became hard of hearing, he was bedridden, but he kept working and he kept doing things he enjoyed. And one of the things he said is, I'm focusing on what I have, not what I lost. Right? And that is so the model, right?
Yes.
So, that's something I think that I'll always remember.
Yes, this is perfect. It's a way to see the life, yeah. We need to change the way. Yes, this is perfect. So you have written several books, and you have like great reference for us. So in your opinion, do you have some book that really change your life or touch your life? Can you talk about some book, not your book, but some book that you say like everybody must to read this book?
Is
Like
it
yes,
a psychology book or like a?
whatever you want to.
I'm going to break it into two parts.
Okay.
That a book, a non-psychology book.
Mm-hmm.
Two non-psychology books are my favorite.
Okay.
One is one that I read a long when I was an adolescent that still resonates, and one is that I read probably as when I was in my 40s that I thought was transformative. Both were novels. Mm-hmm. One was Catcher in the Rye, mm-hmm. and the other is Indignation.
So can you
Catcher in the Rye, of course, is,
yes.
Sure. Catcher in the Rye is, and again, it's so interesting that Catcher in the Rye is about, is by J.D. Salinger, right? This is a great novel about a adolescent who is depressed, mm-hmm. but is really concerned about saving innocence, mm-hmm. protecting innocence. The other book, Indignation, is about a adult. It's written by Philip Roth, and it's about an adult, sort of I guess the best way to say it is a coming of age type of book that has really, really deep, multiple deep meanings about life. Now, in terms of psychology books, mainly you're interested in sort of like the clinical type books.
Mm-hmm. Yes.
Well, naturally are the books by Beck, right? Cognitive therapy, depression, anxiety disorders and phobias, mm-hmm. all of those type of things. The second one is the work by Kendall. Child and adolescent therapy, mm-hmm. cognitive behavioral procedures, mm-hmm. And the more recent work by Bruce Chorpita, mm-hmm. on modular CBT.
Okay, perfect. I will put everything here as a tip for everybody. I hope we have all of them in Portuguese. I'm not sure about the last one, but the Kendall one and the other ones I think we have in Portuguese.
Oh, good.
Yes. So you've written several books, as I said before. And do you have a favorite technique that you already wrote about, or I don't know, that you use a lot in your work?
I love that question. That may be my favorite question, Anna. There are two favorite techniques that I just love to do with kids. One is change your tune, and the other is shake it off. Mm-hmm. The last one I just want to talk about. I'll explain the shake it off one for you in terms of just time. That shake it off is. Do you know who Taylor Swift is?
Yes, shake it off.
Yeah.
Okay.
So
you don't want me to sing. You don't want me to sing.
So it's based on the Taylor Swift song. Mm-hmm. And so what we do is that either, on some device, computer or, phone or whatever, I have the Shake It Off song recorded. Wow. And so what I'll do with the youngsters is say, do you like Taylor Swift? If they say no, then I don't do it. But most, particularly 10 to 14-year-olds like her, right? So they say, yeah. I said, all right, you remember the song Shake It Off? Yeah. So I said, well, we're going to do what Taylor says. So what we do is we write down their negative cognitions on like a sticky pad, a notepad. We then stick the negative cognitions on our clothes. I do it as
like
well.
Post-its?
Like Post-it notes, yes. On Post-it notes. And we said, okay, so we're going to do this. And then we play the song, goes, and then it gets to the verse of, shake it off. And then what we do is we shake it off so that the Post-it notes drop off our clothes and fall on the floor.
Mm-hmm.
And what we then do is we pick them up after we shook them off. And with a blank Post-it note, we write a coping thought and attach it to the negative thought, so they have a coping card.
Oh, perfect.
When doing it.
This is very creative.
So yeah, that's my favorite. That's my favorite.
Can I use also?
Yeah, of course.
And
That's why we're doing it.
Of course. This is really nice, really creative.
Yeah, it's so much fun. Yeah, it's so much fun, and yeah, of course. Yeah, that's why I'm telling you. That's why I'm doing this. I want everybody to try.
I will ask them to put that song here to everybody listen in the video with Taylor Swift dancing. Yeah, amazing. I really like this. Yeah, I have a question that actually was not in the script, but I'm curious. How many patients do you see nowadays?
Nowadays, I'm only doing supervision.
Oh, okay. Okay, just teaching.
Yeah, I'm doing a lot of supervision via the Beck.
Oh, perfect. Nice. So how do you feel to be an inspiration for so many psychologists in the world?
That is just such a tough question. That's a tough question. Again, I would say surprise. The first thing that goes through my mind as you said it is surprised. But as I said, that it's so many. I've really been fortunate that so many people have inspired me that I'm happy that I'm an inspiration to some people. So,
yes, you are an inspiration for me.
Well, that again, I can't tell you how happy that makes me.
Yes. So thank you so much for everything. And I have a last question. Actually, I want to ask you, how do you see psychology forward, in the next years? Nowadays, with the pandemic scenario, I think everybody is talking about mental health. So how do you feel? How do you see psychology in the next years?
I think that, well, first of all, I think that COVID has, if there's an advantage to it, it's made people more comfortable with this, right? With, Zoom and, other telehealth or, remote virtual platforms. So I think that's an interesting, and important development, that it's, for many people, it may allow greater access. Interestingly, when I've talked to colleagues across the country in the US, many people are saying even when the pandemic is essentially over, they're going to continue to do telehealth, which is really interesting. And CBT is a great match for telehealth. So that's one thing, is the use of technology. I think the other thing is, and I'm going to ask you a question before I answer your now. In Brazil, are there enough therapists to meet the needs of the people, of the public?
Actually, I think we have, but sometimes we have low level, of therapists. They don't have opportunity to study or to improve their careers. I think we have enough, but they are not prepared, you know?
Okay. See, and again, so that's a little bit different than here in the States. Here we don't have enough.
Mm-hmm.
So one of the things is, how do we remedy that? How do we fix that and get more therapists into the system? And how do we mobilize the people, the people that we do have, so that they can see as many patients as they need to? So I think different systems. One of the things that we're doing here in the United States is now exploding a bit, is the integrating behavioral health or mental health in pediatric clinics,
Mm-hmm.
so that they see their pediatrician in the same place that they see their therapist. And the pediatrician and the psychologist or cognitive therapist work together on, could be anxiety, depression, or whatever. And that seems to increase access,
Mm-hmm.
because people are perhaps more willing and more convenient to go to a pediatrician's office than to a private office.
Mm-hmm. Yes. So I think here in Brazil, the main problem is, I think some years ago we have some prejudice, you know, about population, like a population prejudice about it's crazy thing. I don't want to see a therapist. But nowadays I think it's like it's a trend, you know. Everybody wants to have their own psychologist. So I think we have like so many psychologists here, as I told you, but I think they need to improve, to study more, I think, here.
And again, I think that probably the other end of that, to kind of piggybacking on what you're saying, Anna, is that we also have to find a way to make our services more accountable.
Mm-hmm.
That we may be, creating more services, but we're going to, as you're saying, want to make sure that those services are competently delivered.
Mm-hmm. Yes. So Robert, I want to thank you so much for everything. Like I think this conversation was really nice. I think the students will love to have you here with us. And can I ask you to say hi to my students? Like, say hi, Psychologia está aqui. I'm Bob Friedberg. I'll be here with you. Can you say a message to them?
Hi. Anna, you want me to say hi, Anna,
students. Thank you so much for your kindness to share with us a little bit of your huge knowledge. So it was really a pleasure to me, and hope to see you. Thank you so much.
My address.
So have a nice day. Great
Happy New Year.
Happy New Year. Thank you so much.
Bye.
Bye.
Quem gostou? Vocês gostaram? Eu tava aqui vendo os comentários de vocês, mas eu quero... Bianca, que momento! Gratidão por esse saber compartilhado. Obrigada, Aline. Ana, impossível não ser uma pista de destaque depois dessa conversa, gente. Ai, gente, que oportunidade incrível. Thank you. Perfeito, sem palavras. Gente, eu também fico sem palavras. Incrível. O Bob é incrível, é ou não é, gente? Ele é tipo um ícone. E a humildade dele, tipo... É isso que eu tava falando pra ele, que todos os grandes mestres que eu já tive a oportunidade de conhecer, eles são exatamente assim. Eles compartilham com humildade e... com muita simplicidade e humildade. Eu acho que essa é a grande sacada e a diferença. Então, eu acho que quando ele fala, né, isso faz parte do modelo, compartilhar faz parte do modelo, humildade faz parte do modelo. Então, o modelo cognitivo envolve tudo isso, né? Então, voltando algumas casas no que eu falei aqui no início da nossa noite, que a gente tem que focar no que a gente tem que focar no que a gente... Deixa eu melhorar aqui o microfone, agora câmbio. Isso, então que a gente tem que focar no sonho da gente e não em todos os problemas. O que é que eu posso fazer? Tá, isso aqui tá acontecendo dessa forma, mas o que é que eu posso fazer então? Que é exatamente o que ele trouxe, que o Beck fala, que o Beck posicionou e que ele posiciona, que ele traz. Então, gente, eu fiquei maravilhada. Então, primeiro de tudo, eu não sei quem me acompanha nas redes sociais há uns 2 meses atrás, quando eu mantive esse contato com ele por e-mail, eu fiquei muito, muito feliz, assim, dele ter aceito o convite, com tanta humildade, com tanta coisa para compartilhar. A gente gravou esse vídeo tem 2 ou 3 semanas e eu tô muito feliz de ter a oportunidade de passar ele para vocês aqui de forma gratuita. Então, muito, muito feliz, certo? Mas antes da nossa aula acabar hoje, ainda tem algumas coisinhas para falar com vocês. Que delícia ouvir ele. Obrigada, obrigada. Ele é incrível, né, gente? Super acessível. O Beck é muito assim, né? Eu tive a oportunidade de conhecer o Beck era muito assim, né? Ele faleceu agora há pouco. Mas ele era uma pessoa exatamente assim, aberta. E aquilo que o Bob falou é exatamente aquilo. Que bom que vocês gostaram. Gente, eu tô maravilhada com esses comentários. Fico emocionada sobre o que ele falou do Beck. Eu também, gente, adorei. Shake it off. Shake it off. Tô doida pra usar, eu não sei. Incrível, né? Muito feliz que vocês gostaram, de verdade. Assim, eu tô bem feliz. Tô até emocionada. Tô